Okay, we are live. So welcome everyone to the Greater Boroughs Partnership for Health meeting. It is March 13th at 1:33. My name is Isabella and I'm the chair of the Greater Boroughs Partnership for Health. I'm just going to read the script and then we'll get started. So this open meeting of the Greater Boroughs Partnership for Health is being conducted remotely consistent with Chapter 2 of the Acts of 2023 relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the board are allowed and encouraged to participate. And this act allows the Greater Boroughs Partnership for Health to meet entirely remotely as long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Members of the public who wish to view the live stream or the recording of the meeting may do so by going to Northborough Remote Meetings on YouTube via the link on the agenda. And ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. All right, members, when I call your name, please respond in the affirmative. So Anne Marie.
Present, Anne Marie Muckenstrom, Boylston.
Chelsea.
Present.
And Isabella present. So with that, we will get started. We do have Michaela Petty on. She is our shared service coordinator and regional epidemiologist. And then Kristen, did you want to introduce yourself?
Hi, thank you. My name is Kristen Matthew Gonzalez, and I spoke with Michaela a few days ago just to kind of understand about the partnership. I'm running for the Board of Health for Boylston. Thanks.
Yeah, of course. So with that, Michaela, do you want to share your slides?
Yes, let me share the screen. Can everyone see that?
Yes.
Okay,
Yes.
perfect. So go ahead and get started, Isabella. Anything else?
Yep.
Okay. So we've got a lot going on. I'm going to try to get through all of it. This is just a brief overview of our agenda, kind of going through shared services, some programming updates, talk about the budget, and then check in on a couple of additional things and wrap up with approving minutes and confirming our next meeting dates. So first, to just talk about what's been going on in our shared services. So I sent out a copy of this brochure before the meeting. Hopefully everyone got a chance to look over it. In compiling this, we kind of thought it would be nice to have a mission statement featured on our brochure about kind of what our goals are. So we have 3 sample mission statements. Hopefully that we could maybe vote on picking one of these today. If none of these fit the bill, we can add some edits and reconvene to talk about a mission statement that we all agree on. But I'll just read through them and then we can kind of open it up for discussion. So the first statement is GBPH aims to address the health needs of our communities through collaboration and coordination of resources to ensure that all residents are able to live their healthiest life. The second statement or second option is to ensure sustainable public health services across our member communities in order to promote, protect, and improve the well-being of all residents, regardless of where they live. And the third sample statement is GBPH strives to improve, promote, and protect the health, safety, and equity in our communities through collaboration. We aim to provide high-quality public health services to all residents, regardless of geographical location. So now open it up to talk about what we like, what we don't like, and kind of go from there.
I'll start.
Go ahead.
So I like number 2, I think, the most, but I would take something from number 3 and put it in there, which would be to end with regardless of geographical location.
Okay.
And I like that one because I think sustainable is really important, especially with how health departments have evolved, especially in the last 5 years, given that yesterday is the day COVID our COVID anniversary or whatever. So I think that sustainability is extremely important because, you know, if you have temporary funding, then it doesn't go very far and it doesn't last very long. So that's my main reason for liking number 2. And I think the well-being part is kind of all encompassing for residents. So that would be my suggestion.
Awesome. Yeah.
Thanks for
I
putting
also
it
like,
together.
yeah, I like the promote and protect in mission statement number 2. So Chelsea, just so I'm understanding, you're saying take 2 and then regardless of geographical location.
Yeah. I just think it's crisper than, yeah, that's all. But you were
Yeah.
probably trying to get different language in each one, so
Yes. Yeah. Yeah, I realized when I was reading them that the last one is 2 sentences and the rest are just one. So
okay.
Anne Marie, do you have any
yeah.
thoughts?
No, I think Chelsea's right. I think that's a great idea. And it's wonderful just so we can bring to our communities what Greater Boroughs is all about. It's good to have that in one area, and that trifold is a great idea.
Awesome.
Yeah, Michaela definitely needs to add graphic design to her resume. Okay, well, I will take a motion to accept mission statement motion.
I move that we accept mission statement number 2 as amended.
I second.
Okay. All right, Anne Marie seconded. All those in favor, Chelsea,
Aye.
Anne Marie,
Aye.
and Isabella, aye. Perfect. So exciting. 3 years later, we have a mission statement.
Yay.
Thank you, Michaela,
Okay.
for coming up with those 3, and we will adjust it, and then we can actually get these printed as well, and we'll distribute them to all of the communities.
Awesome. Yay. That's exciting. Okay, so speaking of all the great work that we do and aim to do, kind of wanted to provide just a summary of what shared services has been doing in the past couple of months. So the inspections, Michael has done a total of 104 inspections since January, and this is just through the end of February, so doesn't bleed into March just yet. And in the bar chart, so the lighter blue is the inspections that have been completed, and then the darker blue is just the number remaining in each town. And we did add Westboro kind of on an as-needed basis recently. So Michael's also been helping out there. And it's expected the remaining inspection should be done by the end of March. It's just kind of the timing of when their inspection was due. And then Penny has been doing blood pressure clinics and home wellness visits, as well as helping out with some vaccine clinics in Westboro with Jim. So kind of just wanted to provide a summary of what's been going on and what they've been up to. And then in addition to inspections and nursing services, I've also been working on some communication resources, like updating our website and trying to make it look a little more visually appealing as much as we can with Civics Plus. And then increasing some social media posts. And then I'm sure you've all seen my emails in your inbox with the bi-weekly EPI updates. Did want to highlight some things that have been ongoing and kind of upcoming in terms of specifically infectious disease communications. Bird flu has still been kind of a big topic of conversation. I know Westboro just put out a PSA about their swans that they found. So there are some communication resources on the Greater Boroughs website, as well as a PSA video that we did with a local vet. And there's a part 2 of this PSA that should come out next week with an infectious disease doc. So if you have any specific community questions that you're encountering and don't really know how to answer, or just feel like it would be good to include in the second PSA, please feel free to reach out. And we're happy to ask those questions. And then measles, probably have all heard about it, and kind of what's going on in Texas right now. So to try to kind of get ahead I've been working on some vaccine information sheets and just general information. While it's not necessarily a risk in our local area, the additional news coverage can prompt some additional questions. So have resources for that in the pipeline. But again, if you have any specific things that you're encountering or seeing, feel free to reach out and we're happy to make those as well. Also on the topic of infectious diseases, I sent this out. Hopefully people have had a chance to look over it. We have been working on kind of finalizing the Maven SOP for our region. So we're all on the same page and know who to contact. We did have Hillary Johnson from DPH look over this. So it's gotten their stamp of approval in terms of workflow and timeline. But really want to make sure that the contacts that we have and kind of that flow of information matches up with what everybody is expecting or is aware of. So do want to open it up now to any adjustments to these responsibilities or the contact information for Maven.
I just have a question, and it's just because I'm not a Maven user. Are there any, and I guess I'll ask for Southborough, are there any other users? Like I don't think Anne is doing the backup for Taylor, or am I wrong?
You're not wrong. So Penny is doing the backup for Taylor, Penny and Michaela, and I think has been on since the contract started as like backup.
Okay,
So it's really more internal. It's Penny.
So should we add like a secondary user column or does that not matter? Like, I'm just thinking like Taylor and Ann are not doing ours right now, and they're the ones listed. Like, should we have another contact other than the primary Maven user column?
That could be helpful to separate out because Penny and I, for most towns, are kind of the primary contact unless otherwise indicated. So definitely can denote that in this table for each town. Does that answer the question?
Yeah, I mean, I think if you say somewhere that you and Penny are the main contacts, and then just asterisk the ones who aren't, I think, yeah, I just looked at it and I don't know that I would think of it if Taylor was not out right now.
No, I think that's a good idea. Michaela, we can kind of flesh out how do we show primary versus secondary versus, backup, however we want to word it. But I do think that's a good idea, whether it be in this chart or somewhere else in the SOP. I think that is important.
Yeah.
So.
Thank you.
Yeah.
And that's what this is for when there's not the normal coverage.
Yeah.
So that's helpful.
Just don't put my name on there.
Chelsea, I wouldn't mind if you called me if I had some infectious disease.
It's just not my forte. No.
All right. No, that sounds good. Michaela, thanks for doing this. And I'm glad this was on our work plan for this year. So really getting DPH's stamp of approval through Hillary has been helpful. She had some, comments and updates. And of course we want to be doing best practice. So that was the background of that.
Great. Thank you.
Oh, and I do have on here, I can follow up with this in an email, but I am working on getting MIS access from each town. And I do need permission from, similar to Maven, where it's like, you have to give permission to give me access to your town. We don't necessarily have to talk about it now because we have a lot of other stuff going on, but I can follow up in an email. That's just so I can pull like vaccine trends so that when we're looking at infectious disease, we can understand how much of our population is vaccinated as best we can.
What was that system, Michaela?
Yes, it's MIS, which is, I think, the Massachusetts Immunization
Information system.
System. Thank you.
Yeah, so Taylor has access to it. It would just be more like pulling data and reporting.
Okay.
But each town can kind of decide that on their own. We won't take it to a formal vote. But Michaela will follow up with instructions if that's something the town is interested in having Michaela have access to.
Thanks.
Yep. Okay. moving on, we're making good progress. Okay, so want to highlight some programs that are coming up in the next couple of weeks. First is we have a CPR AED training April 1st at the Westboro Community Center from 6 to 7:30. And then also in early April in Northborough, we have an Intro to Breastfeeding course that's from 5 to 7. And then we'll have another Intro to Breastfeeding May 5th at the Westboro Community Center. And this is in partnership with Salmon VNA. A certified lactation consultant will be leading this course for new and expecting mothers to kind of learn what to expect when breastfeeding and kind of have that support. It is limited to 10 mothers and their partners if they want to bring them. So that's why we have 2 offerings. Hopefully people can attend one or the other. And then the ClearPath contract starting in March through June of this year with 4 hours weekly. And I may pass it over to Isabella to give more
I can talk a little bit about
information.
So we all had voted on this at the last meeting. I had worked with Lynn to get the 4-hour weekly contract for the rest of the year. So basically they can provide in-home services, which includes assessments as well as clutter coaching and harm reduction check-ins and municipal trainings. So basically the way that the referrals work, as you can see on the screen, either residents can call or email that number as well as, staff, whether it be fire, police, senior center, health department. So the referrals kind of work both ways. Of course, 4 hours is not a ton for the 4 towns, but they will prioritize as best they can. And then they will provide us, me as the main contact feedback about how many hours they're using, how many clients they're helping, and then I can report back. But this is a great way to kind of see how this partnership is working.
On the CPR AED training, sorry.
No, go ahead.
How do people sign up for that? I just can't, it's just small on the screen.
Yes, and I can follow up with the full flyer. They just have to email me is kind of how we decided to have them
Okay.
register. Yes, and for Westboro, they're asking for either cash or check. They don't have like a online payment system.
Okay. Okay. And
And
have you had people sign up for that yet? Like, do you have a sense of how many people?
We haven't had people sign up yet. I don't know if it's on the Westboro website just yet. But yeah, it should be posted soon.
Okay.
So no sense of attendance just yet.
Okay. Thank
And
you.
then Chelsea, I actually just made a CPR training in Southborough on June 18th, but I'll wait for Taylor to do all the details. But I did just get that all settled with Heather Welch.
Oh, great. Okay. And do you know where that's going to be, or you don't have a space yet?
Not yet, but I can
Okay.
I can figure it out.
All right. If you need help, let me know.
Okay, will do. Hi Jen, how are you?
Hi, good. Sorry I'm late.
No, you're busy.
Hi, y'all.
Yeah, but I will actually just because I know Jen, you were interested in this. So we did sign a ClearPath contract. It's 4 hours a week for our region. And then referrals can go through either residents or staff. So again, it's a great resource. I know they actually already had someone they were working with in Westboro, so they just added them onto this contract.
I'm
So
sorry,
they'll
what
get
was it? I missed the first part of it.
the ClearPath hoarding contract.
Oh, great.
So that is in effect and it's 4 hours a week.
Perfect. Thank you so much.
Yeah, of course.
Also things coming up. These are upcoming trainings. Don't feel like you have to memorize this. This will also go out with a follow-up email with links if anybody's interested in registering. All of these are covered under the PHE grant. So any registration is covered. And then we also have some upcoming equity trainings offered through DPH. They're all virtual, so you can join in. The Broadening the Lens is just kind of an office hours type of setting where if you have questions and want to bounce ideas off of experts, you can join those as well. Again, this will go out with links after the meeting. Okay, any other questions before we move on to budget? Okay. So Isabella, I think I'll pass the nursing software up
Yeah,
over
of
to you.
course. So this has been a long time coming. So we were really interested in trying to contract with some nursing human service contract, software contract, to provide a secure software to track our nursing services and educational programs. We looked into two because those were recommended to us, My Senior Center, which some of you may be familiar with, and then My Juna. Both met our IT director's secure, all of that. He interviewed them and had tons of questions for them. But basically it comes down to cost. My senior center is a little bit older. The interface is not as new as my Juna. My Juna is a lot of bit more expensive. I do know other shared service arrangements are using my Juna. So I think it's just really up to discussion about how much we want to spend. Both have similar features. My senior center has a slightly more senior center focused software, so they can do like calendar and events, event signups and things like that. My Juna is definitely more medical focused. We could bill. We're not there yet, but like that type of feature, if that makes sense. So I'm bringing these to you now. Obviously, we only have a few more months of the fiscal year. So both would be able to do a prorated amount, or if we really want to go back and have everyone kind of do demos, we could say this is an FY26 project. It's really up to the group where you guys see.
So am I reading this correctly that after the first year, My Senior Center is half of my Juna? Is that right?
Correct. And then my senior center is unlimited users, and my Juna, it's per user.
Oh, so but you pay the annual amount or the user amount?
Correct. Yeah. So for my Juna, depending on how many people each town wanted, if we fit into that 10 to 15, we would do the 8,400. If not, it would be whatever that math would be, how many users we would want.
I mean, do you envision that it would be more than 15 people between the four towns?
Not more than 15. I just don't know if it would be less than 10.
Oh, I see.
And you said My Juna is more updated?
It's definitely more updated. I would
And
say again, the features are the same and the same type of reporting that we could do. Michaela also sat in the demos, so if you want to share any of your feedback. But it really does come down to cost.
and are we still struggling on spending funds?
Yeah, so this year, yes, but again, if we were hoping to, obviously we wouldn't sign a multi-year contract, but if we were looking to continue this, then we're gonna have to look at funding for next year, which is going to be a little bit tighter if we want to hire a full-time nurse, and then the fringe benefits will be increasing.
So, sorry, back to the math on this. So if
Mhm.
we had 9 users,
Mhm.
that would be $621 a month. So I'm assuming that you would go to the $69 a month if it's over 15 users.
Yeah, that math, I would have to check.
Yeah, so because I think they wouldn't want to charge the 621 if they would get 690 for the 10 to 15.
Right.
So my guess is we would be in the 84.79 annually. And then if we did it for this year and prorated it,
Mhm.
it doesn't really matter if we do it this year or not, right? Because we'd still have to pay for the full year next year,
Mhm.
right? Okay.
Right.
And I think our IT is pretty stringent on
Mhm.
implementing new software, so I would need to get them involved in either scenario. We
Okay.
do already have my senior center, so I think that's probably a easier lift, not that it matters. I think whatever the group wants to go with is fine. I don't, honestly, I don't know enough about the difference between the two to
Yeah.
make a decision on which one's better. But from a budget perspective, what makes more sense? I think that's a question for you, Isabella.
I think right now we have money to spend. I think thinking about next year, do we want to spend $9,000 on software? I think that's the question. So we could table this for now. We could have, each community, if you wanted to, set up demos with, or even like, look at their website, talk to your IT, and then we could come back whenever we're meeting next. I mean, again, it wouldn't help this year, but we want to pick the better service that fits our needs. So that would be one option.
I'm open to doing that, but I'm flexible too. So whatever Jen and Anne-Marie want to do, it's good.
Well, obviously you guys are a lot larger than Boylston, so we don't even have a senior center. We just have the townhouse.
So you wouldn't need as many users, is that what you're saying?
I believe, I mean, I could collaborate with the director of the Council of Aging, but I don't think this would be, would work in Boylston at this time anyway.
So I think it's confusing that the name of it is My Senior Center. It's actually not for senior centers necessarily, Anne-Marie. It has an arm for senior center, and I think that's how and if I'm speaking out of turn, just totally tell me. It started as a senior center software, but it's expanded to be able to include health departments and maybe others.
Oh,
And
okay.
this
I
would
thought
be
it was
more.
just go ahead.
This would be more for like if Penny went out when she does your blood pressure clinics, like she would be able to input that client, information and then track how many blood pressure clinics she was doing, or home wellness checks. Like, hey, I went to Michaela, 4 times this year, and these are the services she asked for. Just better tracking and honestly, case management.
Oh, okay. All right.
I actually would like to be able to watch a preview of what they offer. Actually have Jim do it and see which one he prefers because he'll be the user. So if you could set that up or
no, I think that's great.
That would be great.
So there's no videos, but I will send them the contact information, and then I can let him kind of just schedule that as he sees fits.
Great, thank you.
Perfect. So we'll table this for now. We'll either revisit it next meeting, or it could just be something we start in July, so a new fiscal year.
Great, thank you.
Of course.
Okay, we can go ahead, and another budget item that we've talked about is translation services. So last time around, kind of got input from every town to see what the primary languages were that we might want to translate resources into. And that came back with 4 languages: Arabic, Haitian Creole, Portuguese, and Spanish. Not that these are the only languages, but these are kind of the most common that we see across the 4 towns. And so then I got quotes from MAPPA, which is a Massachusetts-based translation service, and then Language Line, which is more national, but they're the company that the state contracts with for their translation services, to see how much it would be to translate both the food resource guide and the maternal health guide into those 4 languages. So MAPPA is roughly 1,700 and Language Line would be 2,700. So wanting to kind of similar to the nursing software, talk about the pros and cons. There's not really as much of a difference. I've personally used Language Line in the past, but both of these were recommended by different SSAs, so have a good reputation. And services are pretty much equal. But wanted to get everyone's thoughts kind of on the budget and translating these and the languages that we selected.
So I know for Westboro, those languages are perfect. And this is just a one-time, basically, translated guide, correct?
Correct. It'd be translating both the food resource and the maternal child health. Once we have them set up as a vendor, we could ask for additional services, but it would be kind of a fee for service type of setup, not like a annual contract.
And they're both similar, and it's just translating. And I know that we need to spend money, but I have a hard time spending more money on something that, you know, we can get for a lot cheaper, $1,000 cheaper.
I agree, and
the same thing.
Yeah, no, Jen, I totally agree. And I think if you go back to your schools, like I know our schools would probably recommend like 1 or 2 other languages if we had funds. So I would rather translate into more languages than choose the more expensive option. I haven't worked with either of these, so we just wanted to bring it to you all to see if you had any experience with either organizations too.
No, I don't. Thank you though.
I would
No,
rather
I don't either.
this too.
Marie.
Chelsea, say that again, sorry.
Sorry, I would rather add more languages and go with MAPA.
Perfect. Anne Marie, were you also saying something?
No, I'm not familiar with MAPA or Language Line. I think I used Language Line when I worked for the city of Leominster. My question is now, would this be a fee for each town or just for the greater boroughs?
Just for the greater boroughs.
Yeah.
Okay.
Yep, so it would come out of the grant funding.
They didn't say how much extra it would be if we needed other services besides the food resource and the maternal child.
Yes, so they provided, I just totaled these. They provide a per word rate for the different languages. So Portuguese and Spanish are kind of the base language, and then Arabic and Haitian Creole are a little bit more expensive. So this was just kind of the total. But if we did want to add other flyers or resources, that would be on the same per word rate as the others, if that makes sense.
Okay.
I would love to get our
All right,
flyers
thank you.
printed in a different language. That'd be fantastic to put on our websites and Facebook pages or social media.
Yeah, and when I asked for a quote to get like a social media post translated, they did have like a minimum fee amount, which I think was like it was under $100. I'd have to go back and look. So one thing we can do too is like bulk translate, so that we kind of get the most for our money of sending text files and then having the translations back for social media posts.
Great, thank you.
Chelsea, do you think we need a formal vote to contract with MAPA?
I do.
Okay.
So I move that we contract with MAPA to translate the food resource guide and the guide to maternal, child, and family health.
A second.
All those in favor, Chelsea?
Aye.
Jennifer? Jen?
Aye.
Anne Marie?
Aye.
And Isabel, aye. Perfect. So we will get on that. And then we also can use grant funds to print those guides as well.
Awesome. Okay. So speaking of spending, talking about spending down funds, looking for additional, as Isabel mentioned, we're still looking to spend down funds for this year. So looking for any additional resources, supplies, or trainings that your towns would like to have. And kind of in the table is just a summary of the allowable expenses so that we can kind of make sure we're in line with that. But kind of want to open it up if anyone has any additional ideas that we can start working on as we close out the fiscal year.
Could you pay for the membership fees this year for next fiscal year?
Mm-mm.
No.
The only, the only thing we did last year, the MHOA, conference, they had an early bird special and that was allowable, but typically not. So Michaela had one idea, if you want to talk a little bit about Tableau.
Yeah, so kind of from the EPI perspective, one useful tool or software would be Tableau, which is a data visualization software. And we can add that for the remaining months that we have in this fiscal year. It'd be around $500. And then the following for a full year is a little over 2,000 for 2 users. I've used it before, so I'm familiar with the software, and it can be really useful for visualizing Maven data and really a lot of other type of, like, if we want to do mapping for resources and things like that. And the state is integrating Tableau into the data solution that they've rolled out. So having our own account could help with kind of utilizing that functionality in the future too. That is kind of one option to spend down funds and potentially look at utilizing that software.
Do you know how much that is?
Yes, so for the rest of this year, the contract would start in April, and it would be $500 for through the end of June. And then if we decided to renew for a full year, it would be $2,220 for 2 accounts.
So something that I think I'm not clear on. I mean, I'm clear on the FY25 and that we need to spend funds, but and I'm okay with that. I just want to make sure that whatever we're committing to that then bleeds into the next fiscal year, we're all aware of what that carryover is. Because what I don't want to do is put all these things in place and then have to make a decision to cut them because we need to pay for our staff first. So I just don't have a clear picture of that. I'm not saying that you're not taking that into account, but I'm just not clear on where we're at with excess funds for FY26.
Absolutely. And I don't know, Isabella, if you want to hop in and
Yeah, we've been doing some forecasting. I think we would just need to set another meeting probably in April to talk. I was going to suggest this at the end anyways, to start talking about FY26 budgeting. So, I think we just meet in April and that is
Okay.
the meeting to talk about budgeting.
Yeah, I think now could be a good time to get ideas and see how much they would cost and if they would bleed into FY26. And then when we meet again, we can kind of flesh out exactly how that fits. Again, that sustainability piece that we talked about in our mission statement of making sure we're not causing future problems for ourselves.
Yeah. Okay. I mean, so I think my opinion is you put that one on the table.
Yeah, that sounds good.
And I think the big items like nursing supplies, inspectional supplies, like ask your inspectors, your nurses, like what, it really has to have like a regional focus, but say like all of our regional flu vaccine clinics, like what supplies do we need to, make sure we have everything we need.
Okay.
Health communication is a big one we just talked about. So we'll be translating the guides, and, printing material. So that will be all included in that. We only have 3 months left. I'm not sure if we want to think about a consultant or strategic plan.
I think that'd be a great idea.
The strategic plan.
Mm-hmm.
Do you think we have enough time to do that in this fiscal year though?
I think a plan can be made in that amount of time.
And when you say strategic plan, what are you looking for?
I like having someone come in and give us ideas on how to move forward and things that we haven't thought of out of the box. And
Yeah,
I think,
like a 3-year, 5-year plan kind of?
yeah, think that'd be fantastic.
Okay.
I just know what Youth and Family Services is going through with their strategic plan, and I sat on that the last time that they did it, like 4 years ago, and it was a several month process. So I just would want to make sure that we could get it done, because I assume that we would have to make sure the work would have to be complete by June 30th. I think it's a good idea. I'm skeptical about the timeline.
Okay.
Depending on, I mean, you got 4 different towns here. You know, everybody's.
I think it won't hurt to ask to see if it's a possibility.
Oh, I
Yeah,
agree.
does anyone have any organizations that you think would do this? And then again, if it is over $10,000, we would need to go to procurement. I know we worked with CMR.
I was just gonna say that,
Yeah.
CMRPC. Yeah, they're fantastic.
So I could reach out to them to see kind of what the cost estimate maybe would be. What do you all think about that?
Sure.
Okay. All
That's
right.
a good
I'll try to
idea.
have more information at our next meeting. And then, yeah, all of those trainings that Michaela had on the screen, like all of those are great options, to spend down funds, as well as just great professional development. I know Chelsea and I think Maria also went to the MAHB training. I know it's a Saturday, but it actually was a pretty decent, really wide ranging topics. So I would recommend that. I know Michaela, me, Anne Marie, and Michael are signed up, Michaela, I think, right?
Yeah.
So those are good options as well.
I think if everybody could let their boards of health know too,
Yeah,
that would be great. You know, for somebody who's maybe never been to something like that.
absolutely. So we'll circulate this, keep on thinking, send us ideas, and we will do more of a forecasting FY26 budget in April, and we'll pick a date in a few slides, if that sounds good.
Perfect. Okay. So
Everyone hates this slide.
yeah, I think we're all ready for April 18th. So just want to check in. The cost tool is due tomorrow. I think Manise has been in contact with people if they need additional assistance. She's great to work with if you haven't before. But yeah, just more of a reminder, and if you need any support or anything, I'm happy to set up a meeting and see how I can help. But kind of at this point, ideally the cost tool will be done tomorrow. If you are running into major issues or anything completing it, you can reach out to Manise and talk about kind of how to move forward. But yeah, I won't spend too much time on this because I'm sure everyone's tired of hearing about it. But if you have any questions, feel free to speak up.
I will say mine is complete.
Yay!
I know you've been waiting, so it is done.
Amazing. Thank you so much, because I know it's not fun to fill out.
I just need
Okay.
the time.
Yeah, it's an interesting one. And we get to
Yeah, Michaela, which one do you think is more difficult, the cost tool or the service delivery tool? I think the cost tool was a little bit more difficult.
I think the cost tool made less sense and was more, because it wasn't just a regular budget, it was a little bit, there was a little more to it. The service delivery tool I feel like was a little bit quicker, at least for
So
because
we had to sit together and do it for Greater Boroughs. I have not yet done it for Northborough, but just I have them both in my head. But yeah, Manise's great, Michaela's great. We sit down together and do it, and she forces me to make sure I'm answering everything correctly. And then Manise from BME Strategies will actually be presenting some preliminary findings at our May 15th meeting. So that will also help us set some goals for FY26.
yeah, So
So
thank you.
thank you on behalf
Yes.
of Ola Reach.
And we could take a breather, but then kind of once the service delivery tool, we get closer, again, offer still stands to set aside time and fill it out. But for now, we will celebrate Friday. Okay, and then next is contact tracing grant update, which I will pass to Isabella.
Yeah, so we still have these funds, but they are officially leaving us on June 30th, 2026. So in our next meeting, we can also forecast this. We have about $200,000, but the allowable expenses are definitely a little bit more lenient. Chelsea, I did ask about AEDs and they did say yes.
Oh,
So we can work on that. I know it's really busy right now, but Michaela, I might have you reach out to the 4 towns to see how many they would want and where they would want them. But also thinking about like sunscreen dispensers, I do have an email out to Hillary now. So can we buy more? Can we replace sunscreen? One thing that I've been thinking of is we don't have any more syringe disposal containers. So thinking if they would be able to like bulk purchase those for the 4 towns for the Sharps disposal program. But again, much more, I would say flexible with the allowable expenses. So, feel free to continue to think about that. But again, that will be over June 30th, 2026. And the big item that we had on this grant was the Salmon VNA contract. So again, in our next meeting, we have to think about, do we want to continue with the thought process of hiring a full-time nurse, having Salmon VNA on the contact tracing grant and kind of transition that off of the grant? I think those are big questions that we need to discuss.
And I think in terms of the AEDs, once you reach out to all the towns, just so you know, what we did in Southborough is we put them at all the fields. So that was our priority. And so I don't know that Southborough is going to have any where to add to them, but I think it is extremely important that all the towns in the boroughs have them at the fields, given that our kids are playing at each other's fields. So from a Southborough perspective, we are totally fine with, not getting the majority of these funds for the ADs in the other towns.
Perfect.
Or would be supportive of doing it, however you want me to say it.
We understood.
Okay. And okay, very efficient. Now on to confirming meeting minutes. This is the last bulk approval until we get back to just one meeting minutes at a time. So I sent them out beforehand. Want to open it up if anybody has edits or comments, and then we can hopefully approve the last set of minutes.
I move to approve the meeting minutes of June 27th, 24, 9/12, 24, 10/23, 24, and 1/9, 24.
Second.
All those in favor, Jen?
Aye.
Chelsea?
Aye.
Anne Marie?
Aye.
And Isabella, aye. Yay, Michaela. Now we have no more backlog of minutes.
Thanks,
That was
Michaela.
just one at a time. Okay.
That's a lot.
And then,
Thank you.
oh yeah, no problem. Thankfully Northborough got like the HeyGov, which helps make it a lot faster. But yes, happy to be back to just one. And now looking at our next meetings, kind of as we've touched on, it might be useful to schedule an additional meeting in April. If we want to stick with the Thursday schedule, we could do either Thursday the 17th or Thursday the 24th at 1:30 if that works for everyone, or we can open it up to other days if that's conflicting.
So April 24th is school vacation week.
Okay.
Won't do that.
Yeah.
I may have a conflict on the 17th, but Taylor should be back by then.
Okay.
Her first week back.
I know.
We can welcome her back.
Yeah.
We could also look to another day.
Yeah.
Whatever works.
I mean,
Jen, what?
if the 17th, if this time works for people, then and Taylor's available, then that's fine with me. Like, I'll join if I can, but not crucial.
Jen, what is that
The
day? or
17th,
week?
I'm able.
Say that again. Sorry, Anne Marie.
Oh, I'm sorry. The 17th, I'll be in Salem on a
Okay.
family trip. So unfortunately, I will not be available.
Okay. Does anyone have any availability the 16th? That's a Wednesday.
I do.
Depending on what time.
What time are you available?
Morning works better than afternoon. But
I'm flexible.
The 15th works.
Same with me.
We could do the 15th in the morning, like 9 or 10.
Let's say 10.
I'm flexible.
Okay, 10.
What did-
I
what
said
did-
9, Jen said 10.
Do
Fine.
you want to do 9:30?
We
No,
can
that's
make-
fine. 10's fine.
Whatever
Okay.
is, I mean, either one is good.
All right,
make-
so 10 a.m. on Tuesday the 15th. All right, we will send out information about that. And then we will talk all budget and spending down. And then I know, Anne Marie, you had said that MAPHN, that conference is the day of May 15th. Is that correct?
Right. It's the 14th evening into 15th all day.
Okay, so do we want to look to move the 15th to? Oh, I have our meeting on May 8th.
I do too.
Okay. Maybe
My
that's a typo. So does May 8th still work for everyone at 1:30?
Yeah.
Yep, that works for me.
I
I will
actually
update
have
that.
a grant
That doesn't
webinar.
work for you?
No, unfortunately. Would you say the 8th at what time? 1:30?
1:30.
Yeah, no.
Does another time that day work?
The 8th, yes. Anytime other than that time.
Chelsea, do you have any availability that day?
I do. I could do like noon.
Else, unfortunately, the conference begins at noon.
Oh, okay. 11?
Anytime other than noon and 2:30.
Do you have to go? Are you going somewhere or is it in?
It's just remote.
Oh, okay. Could you do 11?
Yep. Yes, I can
Or do you
it.
think we need an hour and a half, Isabella?
That would be our, no,
I'll
I
have
think
one-
an hour is fine.
Because we'll have had one in April.
Yeah, and then Manise
Right
is gonna
before
be
that.
presenting in May, so I think it should be okay.
Wait a minute. What date are we talking about right now?
May 8th.
Oh, I was looking at April. Sorry.
Oh,
1 second.
So are you available at 1:30 on the 8th?
In May, right?
Yeah.
yeah.
1:30. I am. I already have
Okay.
the book, so we're good. I was wondering why it wasn't in there.
Okay, perfect. So we will meet, whatever day in April we decided on. I'm
Yes,
sure
the
Michaela
15th.
wrote it down.
I did. The 15th at 10 a.m.
Thank you. And then, not on the screen, but May 8th, which is already on our calendars, but we will send a confirmation and we will update the slides before we send them out.
Great.
Thank you.
And you'll let
Any-
me say no?
Yes, I will let Manise know.
Anything, any other business, anything you want to all discuss while we're all together?
Nope.
Okay,
I
I
move
move-
to adjourn the meeting.
Second.
all those in favor, Jen,
Yes.
Chelsea,
Yes.
Anne Marie?
Yes.
Isabella? Yes, aye. All right, well, it was so lovely to see you all. We will see each other next month, but feel free to reach out to Michaela or I if you have any questions, need supplies, anything like that.
Great. Thank you so much, everyone. It was good to see you all.
Good to see you.
Enjoy
Thank
the
you.
nice weather. Thanks for joining, Kristen.